Still regarding the new variant of Omicron BA.4 and BA.5, we are now connected to Ibu Siti Nadia, Health Ministry Public Health Directorate General Secretary. Ibu Siti, how are you doing, Bu? Thank you so much for joining us today.
Yes, good afternoon.
Good afternoon, Bu. So, welcome back to our show and thanks so much for joining us. So, it seems like that the Omicron still continue with the new variants. Now we've got BA.4 and BA.5. Can you tell us more about the new variants that we found recently?
Yeah, I think first we have to know that the COVID-19 is the virus based on the mRNA. So with this characteristic mRNA virus, it's usually always have mutation. So we should expect this COVID-19 are going to be Boeing mutation, and we found from the Alpha, Delta, Beta, and now currently the last variants we have from COVID-19 is Omicron, and they already have like several lineage. Yeah, so we call it like a subvariants of the Omicron, and the last subvariant was found with the name BA.4 and BA.5. And WHO already categorized this BA.4 and BA.5 as the variants of Omicron, but still under monitoring.
Okay, so how dangerous is this? Are we going to expect the same symptoms regarding the BA.4 and BA.5 in people? And can the booster shots, if we Indonesians have been having booster shots, can it hold it? Because some of us had it maybe 6 months ago. For the last vaccine.
So I think since BA.4 and BA.5 had been identified, I think there is already like 58 countries already report they already detect the BA.4, including lastly Indonesia, and BA.5 is 63 countries, and mostly the numbers, the highest number of identifying the BA.4 and BA.5 is from the United States and South Africa and England, of course. And if we seen again regarding the transmissibility of the BA.4 and BA.5, it seems they have a more higher transmission compared to BA.1 and BA.2, which we know what happened during January when we're facing the Omicron with the subvariant BA.1. And then it looks like if we talk about the severity, it doesn't show any increasing of the severity. So if we talk about the current vaccine, although some people already have booster 6 months ago, from the data that currently we got from WHO, it is still the vaccine can very effectively against this subvariant, including BA.4 and BA.5. So that's why if referring to our last seroprevalence survey that mentioned like 98% of community already have high protection on antibody of COVID-19. So with those conditions, we have two things that can be effectively work in terms of facing the BA.4 or BA.5. Is the first, the highest protection in the community, and then again the protection individually already established. That's why we really encourage people to get the booster, the third dose, because currently it's only like 40 million people got the third jabs.
Wow, we're running, it's so short compared to the overall population of Indonesia.
Yes.
You know, I've got my third dose of vaccination. I've got my third infection as well. So I've made hat trick actually, Bu Siti, when it comes to COVID-19 infection and also the vaccination itself. But what do you suggest to us who are still, having many activities outdoors? Should we be concerned and worried about the new variants?
Yeah, I think first we have always keep our mind that the vaccine is not against the infection. So the protection from the vaccination that we got is from the death and the severity. So we know the protection against death is almost like 98%, and even the severity of the disease is more than 90%. So the risk of getting infection is still 30%, 20%. Yeah. So we still got the infection, but very less, or even we say that uh, we don't have any symptoms, yeah, and a very short duration of sickness. So I think that's the way the vaccine COVID-19 is working in terms of protection us. So that's why to add more effectiveness for against COVID-19, we always said that the health protocol should be always be implemented. Currently, with a very less number of COVID-19 cases, and then we know very less severe cases, and the death cases now is below 10 cases per day, with the positivity rate is like 1.2%, and the reproduction rate or the transmission rate is less than 1. So I think for the health protocol, we did not yet reduce the health protocol itself. Yeah, I mean, although we say that we are not now allowing people, if they have activities outdoor, they can open their mask, but still uh, in the closed building, or in when you do have activities indoor, you still need to wear your mask. And for the person who, for example, like children under 6 years old, and then a person who have a comorbid, or like a person who did not yet got the vaccination because due to the health condition, of course, we encourage them to keep their mask wearing all the time.
Yeah. Now, a lot of activities are now back to normal, like the school and probably the offices as well, now 75% running. So for the people who got it, because this is quite contagious, as you mentioned before, is there any new medicine regarding the virus, just to probably shorten the period of infections on people?
Yeah, I think up to now we not really find drugs, yeah, for COVID-19. The current drugs we have, like molnupiravir, still very effective, helping in terms of for cure the COVID-19 patient. So, and based on the current information is when people got sick, they just very less symptoms, or sometimes they don't really have any symptoms, and within 3 days or maximum 5 days, they already get well. Yeah, so it's not really a big symptoms or severe symptoms currently we found. So I think, of course, with if we detect earlier and we do the isolation, the same situation that we are facing at the beginning of the Omicron, the same situation still happening currently. So I think because our protection is increasing, that's why the symptom very less, and then it's more short for the duration of the sickness.
All right, Ibu Siti. So earlier we've heard that the health minister is developing a third vaccine. So it's not a booster, but it is for another purpose. Can you tell us what the third vaccine is?
Yeah, it's still under going of assessment, yeah, because we still learn from WHO or from the immunization global institution whether we need to have another routine vaccination. So it means that the COVID-19 should be part of the routine vaccination, or we should get another fourth shot, or like you mentioned, will be like a third vaccination. Yeah. So, but still, it's still ongoing research. We still need here more from the expert and of course from our national immunization expert.
Now, regarding the second vaccine for booster shots, Ibu, is there any possibility that the people of Indonesia will get it again?
Up to now, we don't have yet decided on this policy because, like I mentioned, we're still waiting for WHO recommendation and global immunization group of experts. And then, of course, later the ITAGI as our national immunization expert will again recommend that whether the fourth shot can be used as another additional booster because currently the study mentioned that with the third vaccination and the highest coverage, it will be enough to provide protection among community and against the new variants.
All right, Ibu Siti Nadia Tarmizi from the Health Ministry, thank you so much for your time and for your insights.
Stay safe,
well.
Ibu.
Stay safe.